We're joined now by the chairman of the National Allergy Strategy Group, Professor Adam Fox. Good morning.
Good morning.
Elaine there, we saw, we finished that report saying, I think it should be compulsory. I think it should be compulsory that these adrenaline pens are in these public places, you know, so they're straight away available to be used. Where are you on that?
I'm very sympathetic to that view. I think there's a lot of value in having better access to adrenaline pens. But I think it really needs to be carefully thought through because it's got to be done alongside education and training. There's no value in just having these pens everywhere, but people not knowing when to use them and how to use them. We need really good processes to make sure they don't just go out of date and don't get replaced. And we always have to be really careful about that potential for unintended consequences. So the idea that some people might start to feel that they don't need to take their own adrenaline pens with them because there's bound to be one at the restaurant, or that people don't pay as much attention as maybe they should, or maybe the other way, that restaurants aren't as careful as they should be because they're thinking, well, there's adrenaline here, so if there's a problem, it'll be sorted out that way. OK,
let me kind of come back at you a little bit. Restaurants, it's law, isn't it, that they have to say what allergens, or guidance at the very least, say what allergens are in products.
Well, if they're asked, but unfortunately there's been a catalogue of horrible tragedies.
Absolutely, but they've been highlighted, and they've been highlighted. So maybe we could say restaurants are much more aware. There are people who have no idea they're allergic to certain things, and that's the thing.
We've just seen a lovely example of that.
Exactly. All people who know they're allergic to certain things, and then perhaps it's not said. So having those EpiPens there, those adrenaline pens there, apologies, that's the brand name, those adrenaline pens there can only be a good thing. Doesn't it outweigh the kind of negative? And training, it's happened with defibrillators, hasn't it? So there's no reason it shouldn't happen with these.
Yeah, and there's some excellent examples of other countries, in Ireland, for example, where this has worked well. And I think it's really important that the MHRA, the Department of Health, look carefully at this. And it's one of a number of measures that it would be fantastic if we could progress with in order to just make life better for people who suffer with allergies. But it needs to be alongside all those other improvements in food labelling, in restaurant labelling, managing allergies in schools, managing allergy on aeroplanes. There's so many areas where we could just do better with often quite simple changes in policy, but it just needs a coordinated and joined up bit of thinking and conversations with government to make things happen.
So to be able to deal with the consequences and what to do afterwards, you need to know that you have an allergy.
Absolutely.
So are there a lot of people, I mean, I suppose this is one of those very difficult questions to answer, but are there a lot of people who are thought to have allergies that simply don't know, or have never asked that question?
It's possible that, and of course this is a changing thing, because I strongly suspect that somebody like Elaine, who discovered later in life that she had this allergy, she probably didn't have that allergy 10 or 20 years ago. Things change over time. So people will often ask me about, is there a value in screening everybody? And I think that would be a disaster. Because allergy tests are very, very sensitive, and they often come up with false positives. So this has to be done really carefully. And just screening wouldn't work. It would cause chaos.
What then are you recommending? So somebody might be watching now who maybe something happened to them once. They ate something or something, and they think, do you know what, I might have had a... Well, what's the right thing to do? Because some people don't like to waste medics' time. They don't want to make a fuss. Maybe it hasn't happened again. What should people do?
What we really need to see is better access to allergy care. So a better chance that when you go and see your GP, that GP has been properly trained around how to identify allergy, to take a good allergy-focused clinical history, to know what test to order and to be able to do that relatively quickly, and where necessary, to give that person access to an allergy specialist. And we lag a long way behind other developed healthcare economies when it comes to the number of specialists that we have.
If we know we lag as a country, what's being done about it?
Well, there's a lot of lobbying going on. I'm involved in the National Allergy Strategy Group. I work very closely with specialists at the British Society for Allergy and Clinical Immunology, the big allergy charities.
Is anyone listening?
And, well, we're making progress. We've had some very positive responses to reports, but what we've just launched in the last couple of months is the first national allergy strategy. So this is a genuine coming together of the big allergy advocacy groups, Allergy UK, Anaphylaxis UK, the Natasha Research Foundation, with allergy specialists to really start pushing an agenda to put together a proper blueprint for what best practice allergy care should look like around allergy prevention, around access to care, around management of allergies in schools and restaurants, food labelling, all of these different areas, air quality. It's really broad. And what we're going through at the moment is a consultation period. We're actually throwing open to the public, to everybody. Tell us what your big priorities are. What should we be focused on?
When it comes to allergies?
When it comes to allergies.
How do they do that?
So if you Google National Allergy Strategy Group or go to nasguk.org, you can share your voice. There's a survey on there that allows you to either put forward your views on it or, better still, express your interest in being directly involved in this process. We're planning to publish over the course of the next year and use it as a way of lobbying government more effectively for the change that there's consensus around needs to happen.
I don't doubt you will have a huge response. You maybe already have, but I'm sure you'll have a huge response from people either concerned or their loved ones or whatever. So thank you.
Everyone knows someone with an allergy.
Yeah, Professor Adam Fox, Chair of National Allergy Strategy Group. Thank you for your time this morning.
Thank you.
Pleasure. Thank you.